Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hello and welcome to episode 4 of Clinical Clips from International AIDS Society 2023. I'm Julian Gold, Senior Staff Specialist at the Albion Centre and Clinical Professor of Medicine at the University of Sydney. The first study today is the positive predictive value of HIV serological tests in HPTN 084 trial. So looking at the positive predictive value of these tests, this study was done in 20 sites, and essentially what they found was that overall the positive predictive value for any of the tests was not very high, 74 of 162 tests, but where the 2 rapid tests were supplemented by the antigen antibody test, they found that in fact the positive predictive value was acceptably high at 99%. However, the positive predictive value was in fact lower in the cabotegravir group because of its high prevention efficacy, which resulted in a lower HIV incidence. And that, of course, affects both the sensitivity and specificity of the tests. So the conclusion from this is that in order to diagnose HIV positivity in patients that are taking pre-exposure prophylaxis, it's essential that a number of different tests are done in order to reach the accurate conclusion. In our next study, we're looking at the acceptability of long-acting cabotegravir in young cisgender female adolescents in sub-Saharan Africa, in South Africa, Uganda, and Zimbabwe. So this was a single-arm, open-label, phase 2B safety study in 55 cisgender adolescents who were all less than 18, and 92% of patients chose to continue on long-acting cabotegravir overtaking the TDF-FTC pre-exposure prophylaxis. And following in-depth interviews, the concern that some patients on injectable cabotegravir have, of course, was the site pain, the fear of injection, and the possibility of side effects. But by and large, all of the patients that continued on were quite enthusiastic about continuing the injectable, as they found the adherence was better, discretion and knowledge of efficacy, administration mode, and familiarity with use of injectable contraceptives, and also that in this case, each of their parents and guardians accepted and approved of this method of pre-exposure prophylaxis. So in our next study, which again is part of the HTPN cohort study, the idea was to look at the initial PrEP choice. And in this study, those patients who initially chose to go on the cabotegravir, nearly all of them, or 78% of them, chose to continue on with the cabotegravir, and 22% decided that they would either continue with the TDF, or a few decided to swap to TDF. Those that swapped from the injectable cabotegravir to the TDF-FTC basically said they prefer pills and they don't like injections. They were concerned about the injection site pain, and they found clinic visits were more efficient. So when they looked at why patients made their decision about what to choose, essentially there were two things. Primarily, people made their own decisions. So 70% of people in both groups decided what they wanted to do. So these were independent decisions. But interestingly, in both groups, about 20% relied quite a lot on study staff for advice. So that it's important that in the clinics that the staff are trained and are able to give patients really objective and non-influenced advice about what potentially they could use for prophylaxis and for treatment. So this study was the willingness to use long-acting cabotegravir during pregnancy in Africa. In this study, there were 16 patients who became pregnant while they were taking pre-exposure prophylaxis, and they decided at the time that they wanted to continue and to protect themselves and their children from HIV infection by being treated with cabotegravir. So they continued on using injectable cabotegravir in preference to oral TDF-FTC. But by and large, universally, they wanted an assurance that the injectable cabotegravir wasn't going to have a negative effect on either themselves or on their fetus or their babies when they were born. So the final study in this group, again, looked at anticipated preferences for long-acting PrEP amongst patients who came to pharmacies. And this study was done in Kenya, and they were given a choice of either having oral TDF-TAF, TDF-FTC, or injectables, or given the Darubrin vaginal ring. And the results were really quite supportive for injectable PrEP, where over all of the 500 respondents, 65% chose the injectable PrEP versus 35% the oral TDF-FTC. And virtually none of the females chose the vaginal ring. So it wasn't very popular at all, considering it had to be changed every month. And in the subgroup analysis between the males under 25 and over 25 and females under 25 and over 25, the only real difference is that females over 25, more than 80% chose injectable PrEP versus about 60-40 in all of the other groups, 60 injectable versus 40 in the groups. So that brings us to the end of the fourth and final episode of Clinical Clips from IAS 2023. And please visit the landing page to view the slides and the clips from this conference. And it's been a great pleasure presenting these clinical clips. And thank you very much.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.